The respiratory symptoms Patrick has presented with include a regular cough and dyspnea. Factors which have contributed to these respiratory symptoms include Patrick's diagnosis of chronic obstructive pulmonary disease, COPD, and history of left-sided heart failure. Emphysema and chronic bronchitis are two diseases that fall under COPD. It is not uncommon for a person to have both emphysema and chronic bronchitis, which are characterized by damage of the airways. The main cause of these diseases is active or passive smoking, and equally if a person has previously been a smoker. Clinical features of COPD include dyspnea and a chronic cough. As a result of left-sided heart failure, also known as congestive heart failure, the left side of the heart is damaged. Damage to the left side of the heart impairs forward motion of blood. This causes a backward effect and leads to the accumulation of blood in the lungs. This accumulation can lead to pulmonary edema. Clinical features of pulmonary edema include a cough, fatigue, and limited tolerance to physical activity. Patrick's heart rate is 155 beats per minute. The normal range for an adult is 60 to 100 beats per minute. Factors that have contributed to Patrick's abnormal heart rate include his COPD diagnosis and his worsening of left-sided heart failure. COPD can lead to ventilation mismatch. This involves low oxygen levels and high carbon dioxide levels. Patrick's blood tests confirm low levels of hemoglobin, so we can assume acidic hydrogen is not being sufficiently buffered. Chemoreceptors in the aortic arch detect this and stimulate the cardioexcitatory center to increase the heart rate and vasoconstriction to keep the circulation moving. Another contributing factor is Patrick's history of congestive heart failure, which causes insufficient cardiac output to the systemic circuit. As the blood flow to the brain, heart, and lungs is prioritized, the perfusion reaching the kidneys is less. If the kidneys are detecting decreased blood volume, even though the blood volume everywhere else in the body is sufficient, the renin-angioaldosterone system is activated, leading to an increase in blood pressure and volume. This means the heart has to work harder to pump the excess blood out. The main cause of COPD is smoking. This means the likely cause of Patrick's diagnosis of COPD is from his history of smoking. Patrick smoked for approximately 40 years, and although Patrick ceased smoking over 10 years ago, the damage is unfortunately progressive and irreversible. The development of COPD is a result of damage to the airways. Cigarette smoke damages the alveolar walls, breaking down the elastic fibers, which makes it difficult for the lungs to recoil. The cilia is also damaged, impairing their function of keeping the airways clean. Patrick had a myocardial infarction, also known as a heart attack, to the branch of his left coronary artery at the age of 68. A heart attack can lead to heart failure. Heart failure develops when there is insufficient blood providing oxygen to the heart for more than 20 minutes. This is commonly caused by a blockage in a blood vessel from fatty deposits and hardening of the artery wall. Modifiable risk factors include smoking, a sedentary lifestyle, and dyslipidemia. If the blood vessels cannot widen, the blood volume and oxygen is restricted. This results in cell death and reduced response to electrical impulses, leading to the failure of contraction, impaired altered cardiac output, and this is what results in heart failure. Whichever side of the heart the blockage is on is the side that is affected by heart failure. In Patrick's case, his myocardial infarction occurred to a branch of his left coronary artery, which led to his left-sided heart failure. Patrick's diagnosis of COPD developed independently as a result of his history of smoking. His left-sided heart failure is a result of the MI he suffered, which may also have been a result of his smoking history. While Patrick's COPD would not have caused the left-sided heart failure, it certainly would have worsened the condition. COPD results in low levels of oxygen in the blood, meaning the blood is not being oxygenated properly. This places extra pressure on the heart, as the heart now has to work harder and pump faster to deliver oxygen around the body. This can worsen the symptoms of left-sided heart failure. COPD can, however, lead to right-sided heart failure. As the body tries to compensate for the low oxygen levels in the blood pressure inside the arteries is increased. This can result in pulmonary hypertension, which places excess strain on the right ventricle and increases the workload. The right ventricle expands in size and is overworked. It eventually becomes weaker and loses ability to efficiently pump blood to the lungs. In the long term, this can lead to the development of right-sided heart failure. Left-sided heart failure is also a risk factor for the development of right-sided heart failure. Normally, blood flow through the heart is in one direction. It travels from the systemic circuit to the right side of the heart, then through the pulmonary circuit to the left side of the heart, where it is then distributed throughout the body. Because Patrick has suffered left-sided heart failure, blood accumulates within the pulmonary circuit, making it difficult for the right side of the heart to eject its blood output, and this in turn can lead to the development of right-sided heart failure. From Patrick's blood test result, we can determine there is an electrolyte imbalance. The results show hyponatremia, hyperkalemia, and hypocalcemia. The results also show Patrick has dyslipidemia by way of increased levels of LDL, triglycerides, and decreased levels of HDL. Additionally, Patrick also has high blood glucose levels and, as previously discussed, low hemoglobin levels. Electrolyte imbalances in the elderly are commonly a result of impaired renal function. Impaired renal function can be the result of kidney disease, which manifests from cardiac disease and smoking. Dyslipidemia is generally the result of modifiable risk factors, such as diet, sedentary lifestyle, and smoking. Similarly, contributing factors for high glucose levels can include dietary factors, reduced physical activity, stress, and an increase in hormones that increase blood glucose levels, such as adrenaline. Contributing factors for the low hemoglobin levels have possibly occurred as a result of Patrick's COPD and ventilation mismatch. Electrolytes have an important role in neuron function. Electrolyte imbalances can cause neurological disruptions that affect brain function. High blood glucose levels can cause a person to feel drowsy and lethargic and even affect their vision. More serious risks include seizures and coma. Together, dyslipidemia and low hemoglobin levels, hypoxia, place Patrick at risk of a thrombotic or embolic stroke. An additional blood test that could be completed for Patrick would be to check his blood pH. Based on the current clinical information we have for Patrick, it is expected his blood pH would be low due to an acid-base imbalance. A normal blood pH is 7.35 to 7.45. Anything below 7.35 is considered acidic and is caused by a buildup of carbon dioxide. This would be exacerbated by Patrick's COPD diagnosis.